Hello, all. My name is Chelsea Magnan, and this is my partner, Erin Partica. And we are trying to introduce our clinical project, engaging bedside nurses to determine workplace-specific barriers to the utilization of virtual nursing. We have the problem that overarching problem within the healthcare industry is that there are staffing shortages, and this increases the strain on all of the health systems and of the quality of patient care. For our particular organization, this relates to the virtual nursing program that they have already launched. Virtual nursing offers a great solution to some of these staffing woes. However, there are some very prominent workplace specific barriers that need to be assessed at our organization to help determine why adoption numbers are low. The aim, of course, of our study is to determine which workplace specific barriers are impacting the nurses, the boots on the ground nurses working there, and to gain some insight on their particular solutions to the barriers and how they would like to see this program change to suit their workflow. And then our outcomes, we're hoping to empower nurses and engage them so that they understand that their voices are going to be heard. We hope to gain barrier insights to exactly what is the problem for them and why they are not utilizing the virtual nursing program as it is currently. We also hope to detail some actionable plans for our organization to help increase the adoption rates of their virtual nursing program.
So, when kind of doing the research to back our project, some of the themes we found throughout the literature were workforce pressures. There's a lot of high turnover and burnout rates among nurses, especially kind of in this post-COVID era of bedside nursing. The use of potentially utilizing virtual nurses can enhance kind of some of that patient care. It can take off some of that load off the bedside nurses and reduce some of that strain. And then there were barriers identified in research that were pretty common. Each virtual nursing program was a bit different, but technological gaps, unclear roles about how the virtual nurses fit into the workflow, and then just cultural resistance among bedside nurses tended to be common throughout some of these projects that we've read about.
So to analyze the data, our plan is that we will monitor the accuracy. So response rates are going to be tracked and complete surveys will be dealt with, hopefully sent back for completion. We'll analyze, we have qualitative data, quantitative data in open-ended responses, as well as a Likert scale that we will distribute to assess barriers and personalized solutions for these nurses. We use multiple different instrumentation validation tools like Cronbach's Alpha, and just to be sure that we are because the Likert scale isn't as vetted out as some other data analysis tools, we'll make sure that the data we are collecting is valid.
And to implement our plan, we're planning to distribute our Likert Skill Questionnaire electronically. We're also including an evidence-based infographic just to give the nurses taking the questionnaire a bit of background information about virtual nursing, how it can actually help enhance their workflow, and then just some of the statistics out there about how it's been helpful in other settings. Some of our engagement strategies include hosting forums. Chelsea and I are going to go up and give a little presentation to the units that our surveys are going to be implemented on. We're also using champions to send reminders and achieve, we're hoping for about a 60% participation rate on the 2 units we implement on. Stakeholder collaboration. We are planning to do bi-weekly meetings to track progress and finalize our recommendations through as the data kind of comes in off of these scales. Barrier analysis. We'll classify barriers into categories and synthesize the solutions of the nurses' feedback. Our questionnaire has some open-ended questions so they can write in possible solutions and things they'd like to see change. So that barrier analysis will kind of help break that down. And then finally, framework application. We are using Rogers' diffusion of innovations theory to help guide our virtual nursing improvement plan.
That's just a little snippet of our clinical project. If you have any questions, comments, or concerns, feel free to reach out.